everyone. This is City Councilor Michelle Wu. Welcome to our Facebook live stream. We are trying to model social distancing, so I am here with Dr. Denise De Las Nueces of Boston Healthcare for the Homeless program. I want to do a quick sound check, so folks who are tuned in, can you just can you hear us if we're this far away to try to get both of us in the shot? Let's see what the comments say. Can people hear Brianna?
Yes, Dave said that he can hear.
Okay. All right, we'll try to keep our voices up, but if you can't hear us throughout, just give a quick comment and then we'll remember to project. So this is the second in a series that I've been doing to try to make sure we're getting as much information out to the public as possible. It is a time when a lot of changes are happening and are happening fast. So during this coronavirus COVID-19 epidemic, we want to make sure that everyone is staying safe and healthy, but also that we're getting your questions answered. So I'm really excited to be here with someone who is a leader and working at the front lines every single day to make sure that our residents experiencing homelessness have the care and the treatment that they need. I should back up and say that we had asked for questions. What do you want to know about coronavirus? What do you want to know about COVID-19? So many people were concerned about how we are supporting community members experiencing homelessness. So I want to thank Dr. De Las Nueces for making time on such short notice to have this conversation with us. Also, a quick shout out to folks who are supporting the community day in and day out. MAP has been very, very helpful. The Mutual Aid and Advocacy Program, I think that's what MAAP stands for, but I want to give a shout out to you also for lifting up the voices of community members, and some of my questions are based on that feedback. So I'm going to interview Dr. De Las Nueces. I will have my phone here where I'm getting your live comments fed into me, and so I'll try to do a mix of questions that I have and questions that you're feeding it, so keep them coming. So Dr. Denise, could you just tell us a little bit about what is Boston Healthcare for the Homeless? What's your role here, even before the COVID epidemic?
Sure. Everyone, thank you so much as well for having me, Councilor Wu, especially. So Boston Healthcare for the Homeless program is a federally qualified community health center. We've been in existence for over 30 years now. And our main express purpose and our mission is really to provide the highest quality care equitably for all homeless individuals and families in Boston. We have over 40 sites in the greater Boston area. Our locus, really, our focus, our main headquarters, so to speak, is here in the South End, Roxbury border on 780 Albany Street in Mass Ave. And so what we do is provide primary care as well as urgent care and other subspecialty services, including dentistry, for families and individuals experiencing homelessness. We have really been incredibly thoughtful and planful over the course of the past weeks around our response for COVID-19, because we recognize, based on our work for the past decades with our population, that individuals experiencing homelessness are at really increased risk in general, but also in terms of exposure to and complications of infectious diseases. So we're really grateful. I'm grateful, and our program is really grateful to you all for tuning in and for your interest in how we and how the city and state is taking care of residents who are experiencing homelessness.
And tell us a little bit about your role as medical director. What does that mean you do here in general, but also during this outbreak?
Sure, absolutely. So I am a physician. I've been trained in internal medicine and as well as addiction medicine. And I've been here in the program for about 8 years now. And so in that role, I see patients. I do have a primary care panel of my own. And I also am deeply involved in the clinical leadership and operation here in the program. So everything from formulating policies and procedures for how we provide care for our patients to supervising the physicians and helping with the workforce as well. Excuse me. So it's, I think what we've been doing in terms of the COVID-19 response. Myself as well as other clinical leaders have really been working nonstop for the past few weeks, thinking about how we can shift our services to increase our capacity to respond to potential cases of COVID-19 in our patient population. I will say that thankfully to date there have not been any cases of COVID-19 among residents experiencing homelessness here in Boston. Despite that, though, we recognize that if there were to be a case, that the repercussions for this population would be really significant. And so that's when we put all of this planning in place.
And say a little bit more about that. I mean, what
Sure.
are the ways in which COVID, what we know about the virus and its potential to spread in certain ways, what does that mean, especially for residents experiencing homelessness in terms of particular vulnerabilities or other ways that the community should be aware of?
So we recognize that this COVID-19 and this coronavirus is a respiratory virus that is spread through droplets and through contact. And because of that, that's why all of these somewhat extreme social distancing measures have been put in place. It's really, we recognize that these preventative measures are key important strategies. They're the biggest tool in our toolbox to help decrease the spread of coronavirus. Individuals who are experiencing homelessness don't have a home where they can hunker down for the next few weeks. And by virtue of that, they already are at increased risk of not only acquiring the disease, but also spreading it among themselves. We also know that COVID-19 is particularly dangerous for individuals who fall into certain risk categories, in particular the individuals who are above age 60 and individuals who have underlying chronic diseases. And what we know from our homeless population is that we have a really high prevalence of chronic diseases among the patients who we serve at Healthcare for the Homeless. And so because of that, by virtue of not only the density of the spaces in which they do live now, as well as their underlying chronic diseases, we recognize that they are at increased risk for complications if they were to become sick with COVID-19.
And there's unique challenges for recovery too, right? Because we're hearing that, if you are exposed to the virus and contract the illness and are treated and recover, then you're still asked to self-quarantine, for example, for a period of time. And so if someone doesn't have a personal space that they own to go back to, what happens, and how are you thinking about getting ready for that?
Yes, I can talk about our response in general, including that ready. So the first piece, the first part of our response is really trying to promote social distancing in our population, not only here at our health center, but also working with our shelter partners as well. And so by that I mean instituting, stripping down of our services to really only our crucial essential services. We actually are now transitioning into disaster medicine, it almost feels like. We have stripped down and shrunk our services so that we're really offering not as much primary care scheduled appointments, but rather urgent care appointments. We're focusing on medication refills, on getting people the essentials that they need to really get through this period. And also to help limit their exposure and limit their coming to and from the health center and to and from the shelters as well. We are also, so we have stripped down and really suspended all patient groups, and we've also suspended volunteer services. We are deeply appreciative of our volunteer services, and in fact are really dependent on them here at Healthcare for the Homeless. But we recognize that in order to decrease the density of individuals here at our site, these are important measures that we have to institute and take place. We've also suspended learners. So by the learners, I mean medical student and nursing students who provide patient care at our health center. And we've set up hand sanitizing and hand washing stations at our clinical sites. With the express purpose that whenever anyone walks through our doors, we ensure that we not only check them to make sure that they don't have exposure factors or symptoms that are consistent with COVID, but we also encourage them to wash their hands. And in fact, if they don't want to engage in hand washing, then we ask them kindly to leave our premises. We're really trying to be stringent about infection control. So that's one facet of it. And our shelter partners are doing this as well. They have taken this message incredibly seriously and have been working really hard at all levels to institute, for example, hand washing, screening, and also making sure that they stagger meal times and things like that. The second big part of our response and of our planning is really planning for what we would do once potential cases emerge. And so what we have been doing over the course of the past few weeks is readying a COVID ward here at our medical respite facility on 780 Albany Street. So there's a small handful of beds that we have partitioned. We have walked infectious disease experts through this so that we can make sure that it is an area where we can safely isolate individuals who are confirmed to have COVID-19 without exposing anybody else in the building, in the facility, or other patients as well to the infectious disease. So that's actually ready, and we could take someone in as soon as today if there were to be a case. And then we've also been working really closely with our shelter partners as well as the city, the state, and our hospital partners to identify spaces to where individuals who are confirmed to have COVID-19 or are suspected where they could go after confirmation of the disease or even while awaiting testing. So the city in particular is leading those efforts along with the state, and we're incredibly grateful to them for doing so.
So just having spaces kind of on standby if we get to the situation where it'll be spillover from the beds that you have ready here, and we'll need to go to other places. Right. And so this whole transition, the shifting away from all the sort of standard work that you're doing in the types of services that you offer, and condensing everything to really be ready for when a potential spread might happen, is absolutely necessary for public health in this moment and to be totally ready. I imagine it's also incredibly stressful for your patients to know that the other services they need might be harder to get, or that they no longer have support networks from being able to come to patient groups. So how should we think about how to keep people connected to supports in the meantime?
It's a great question. So we are planning that this would last around several months, so 2 months or so. But as this evolves, I can't say that with certainty because that may change as this evolves. However, we are, and something that I forgot to mention is as we're stripping down on our services, we are increasing our telemedicine capacity so that we can do exactly that. There are some instances where we can remotely still provide support services for our patients, and we recognize that's incredibly important for our patient population, and we are exploring all avenues in which to do so.
Got it. So what should individuals know, right? So I'm going to get to the policy implications, but just for what advice you would tell your patients or other community members experiencing homelessness, what does social distancing actually mean, and how would you kind of see that happening in their day-to-day lives?
Yeah. So how I'm counseling my patients around COVID-19 and how to keep themselves protected and healthy is, number one, I know it sounds so basic, but really preventative measures are really one of the core foundational aspects that we can do. It's what we have in our control to help protect ourselves. So hand washing more than you think is necessary, using hand sanitizer if you don't have soap and water available, soap and water is best. And I think practicalities that I talk to my patients about is not sharing utensils, not sharing cigarettes, making sure that if you are sick, and you do end up with a cough, that you practice good cough etiquette, all of these things that not only, so the first pieces are to keep yourself healthy, and the other pieces are, if you were to become sick, to help prevent you from spreading it to others and keep others around you healthy as well. Beyond that, I think avoiding congregating in large crowds and large spaces as much as possible, but we recognize that that's really challenging for individuals who don't have homes of their own. And that's why the measures that the shelters have put in place are so crucial and so instrumental for helping to promote social distancing in this population.
And so thanks to Anna for that question that came directly from her from Facebook. I also want to note that, again, members from the Material Aid and Advocacy Program have questions, and they're going to be posting them. So many of those will come from those advocates and community members. So just thinking through, if someone is not feeling well, they've been practicing social distancing, there's also the flu going around, there's other things, the weather's up and it was snowing this morning for a little bit of time. So what should someone do if they feel like they might have a fever or a cough or some of these other symptoms?
First and foremost, if you're a patient of Boston Healthcare for the Homeless Program, so I'm talking specifically about residents experiencing homelessness, we do have a 24-hour, 7-day-a-week answering service. So there's always a provider, either a nurse practitioner, a physician assistant, or a medical doctor who will answer your call. And you can talk through with this individual your symptoms and whether or not the symptoms rise to a level where you should come into the clinic to be evaluated. We do have some individuals in our patient population who may be doubling up, so they may have a place at which to stay if they don't feel sick enough, or if they don't sound sick enough that they need to be transported for an actual clinical evaluation. So in some cases, our answer may be, if you do have a shelter, why don't you stay there? We can check in on you. If you don't, if you're, for example, on the street or at an emergency shelter, we do have clinics at all of the city shelters actually where patients can go in and be seen. And first and foremost, if they are symptomatic with symptoms that would be concerning for COVID-19, we would place a surgical mask on them, and then a nurse or a provider would evaluate them. If there's any concern, then we would recommend testing and transport that individual to a testing facility.
Yeah. So the first thing, though, ideally, even before going to a shelter where there might be other folks in proximity and going to the clinic there, is to try to access the hotline. Do you know the hotline off the top of your head?
So that it's actually a paging service, and that paging service is for patients who are registered patients at Boston Healthcare for the Homeless Program, and that number is 781-221-6565. All of our patients should hopefully know that. Beyond that, though, if you do have a connection with a primary care provider, I would recommend reaching out to the primary care office via page first to help triage whether or not you should leave and go into an actual clinical setting.
Got it. Okay. And then so just moving to the policy topic for a minute. There's lots of questions still coming in, so keep them coming in. Thank you. Are there certain proposals, either at the city level or the state level, that will help residents experiencing homelessness during the crisis? And what can individuals who might want to call their legislators or city councilors or someone else, what should we be asking for in that advocacy?
That's such a great question. Thank you so much for raising it. I think I can say with certainty that the city and the state have been working nonstop on trying to identify spaces for individuals who are homeless for isolation and quarantine. Once they are symptomatic, let's say the symptoms have been maybe concerning for COVID, or once they've been exposed to a confirmed case. So that's really a broader question for the city and the state, but I can say with certainty that they are working nonstop, and I'm really proud that they're doing so. We're really working hand in hand with them in coming up with creative, innovative resources for our residents experiencing homelessness.
And for folks who want to volunteer in some way, even if I know you said you're scaling down volunteers here, are there things that people could donate or do in some other capacity where they're not in direct contact with folks?
That's a great question, and I'll tell you that if you asked me this question before the COVID-19 pandemic, my response may have been very different. But given how we are stripping down our services to essential services and to urgent care, we are modeling and projecting that we will be losing hundreds of thousands, if not millions of dollars. And we as a community health center are not alone. Actually, many community health centers in the area are really expecting that we will lose a lot of revenue. And this is losses that will be deeply impactful for our ability to flex in order to meet the needs of our patients, as well as flex in order to continue to provide the essential services that we need to provide. So I would say that at the moment what is most needed, to be very honest, would be unrestricted donations to our program to help us be able to innovate and provide these essential services in a flexible and also in a kind of like emergency way. And folks who are interested in doing so can visit our website, www.bhchp, that's B as in boy, H as in Hector, C as in cat, H as in Hector, P as in Peter.org. For more information on how to do so.
Got it. And we'll make sure that link gets posted up for everyone as well.
Thank you.
Okay, so I'm just checking through a couple other questions that I had. In terms of expanding to telemedicine, are there, if people are asked to stay in a safe place and ideally a distance away from others, do you have need for more technology donations so that folks could access, have that conversation with their healthcare providers?
We absolutely do. We absolutely do have need for more infrastructure like tablets. It need not even be fancy high-end tablets, but if you think about even the needs of isolating individuals who are confirmed cases, it can be incredibly boring to be pent up for weeks at a time without some technology to keep you entertained. And oftentimes we don't have the ability to provide television, tablets for all of our patients. So that in fact would be a hardware need that I could see would be really helpful.
Okay, that's great. Okay, let me do a quick check. So people on Facebook are wondering, in terms of supplies getting to shelters, are there still places that they can go to get clothes, underwear, socks, etc.? Or is that going to be limited to now with social distancing?
That's also going to be limited. I can't speak for the shelters because we ourselves are not shelters, but I can say that akin to what we are doing at Healthcare for the Homeless, the shelters are also really stripping down to the most essential services, and I do believe that those services will be temporarily suspended, but that will happen on a shelter-to-shelter basis.
Okay. And then a similar question for community members experiencing homelessness. Is there increased access, so much is being stripped down, but is there more access for hand washing or showers for people who want to try to kind of just make sure that they're limiting the ability to pass it on or to stay clean and sanitary?
I think the access to hand washing and showers has always been an issue, unfortunately, for residents experiencing homelessness. So I don't necessarily see an increased capacity at the moment. However, in these spaces that are being identified, where individuals who are symptomatic or who are exposed, where they can be diverted outside of the shelters, we are absolutely, and the city is absolutely keeping attention, or keeping the sanitation needs, running water needs, or the ability to have running water if possible, and shower needs at the forefront. So that's something that we are taking into consideration.
Got it. Okay, so we're running close to time. We have time for probably one or two more questions. Wanted to ask about your thoughts in terms of patients struggling with substance use. How does that impact their ability to get treatment or to be in spaces where they might have more support?
So we are thankfully in a city and in a state where there's recognition about the importance of addiction services, and also the importance of how the needs of individuals struggling with addiction intersect with these needs on the public health level now. And so as we are working with the city and the state on identifying spaces for individuals who are either suspected for COVID or confirmed cases or exposed, that will be in the forefront. We are actively thinking through how to better meet the needs of individuals who may need to be isolated or quarantined, while also meeting their needs from an addiction or substance use perspective.
Okay, well, Dr. Denise, I want to thank you so much for your time.
Thank you so much.
We'll get some of the resources posted so everyone can have them. My takeaways in terms of things to remember, particularly for our community members experiencing homelessness, to wherever you can, wash your hands with soap if you have access to soap and water, with hand sanitizer if you don't at the moment. Don't share utensils, don't share cigarettes, try to practice good cough etiquette, and keep a good distance from folks. If you feel sick, the best thing to do first is to call the hotline here at Boston Healthcare for the Homeless, and there are policies being put together at all different levels between the healthcare providers, our shelter providers, Boston Public Health Commission, the city, and the state, to make sure that we are ready when there might be a point in this where we'll be moving towards treatment and isolation and keep getting folks well again.
That's right, and the hospitals have been tremendous partners as well, so I do want to mention the hospitals as well.
Thank you so much, Doctor, and thank you everyone for tuning in, and we will see you soon.